Hello, I'm Dr. Yvonne Chu. My background is in internal medicine and sleep medicine, and today I'm going to talk to you about the bidirectional relationship between sleep and immunity. We've all experienced it. When we get sick, we may develop a fever, we feel tired, fatigued, and we want to sleep a lot. And it's thought that the role of this sickness behavior is to conserve energy as our body mounts an immune response to fight off this pathogen. When we look at polysomnography tracings, we see that there's an increase in non-rapid eye movement sleep or non-REM sleep. And we also see at the same time that there's a decrease in REM sleep. Now, in particular, there is an increase in the slow wave or stage 3 sleep during acute illness. And slow wave sleep is felt to be the most restorative of the stages of sleep. So it makes sense that when we're ill, the slow wave sleep is increased. At the same time, REM sleep is suppressed. During REM sleep, our bodies are paralyzed. And as we know, we shiver to produce fever, so the shivering mechanism is suppressing REM sleep. The body gets alerted to the invading pathogen, and the body then goes on to mobilize its immune defense mechanisms, and the whole point is ultimately to isolate and destroy the pathogen. So during this acute phase response, there's an upregulation in the inflammatory cytokines. And many of these cytokines have been studied to be related to sleep. And in particular, the most studied of these cytokines are IL-1 beta and TNF-alpha. Both have been shown to regulate non-REM sleep. We know that in sleep-deprived individuals, IL-1 and TNF are both increased. Likewise, when we are infected with a pathogen, these levels are increased as well. And in response, non-REM sleep is increased and REM sleep is suppressed. In some human studies, giving subjects who are sleep deprived blockers for TNF and IL-1 in the form of antibodies and receptor blockers, there is a loss of the rebound stage 3 sleep that we would normally see in these sleep-deprived individuals. We know that in shift workers who are thought to be chronically sleep-deprived due to the constant shifts, changes in their shifts at work, and also the circadian mismatch that goes along with it. Well, these individuals are shown to have higher incidences of getting infections compared to non-shift workers. In another study with healthy volunteers who are given nasal droplets of rhinovirus, it's been shown that those who chronically get less than 7 hours of sleep a night are 3 times as likely to develop the common cold compared to those who routinely get 8 hours or more of sleep. And then there's studies on adaptive immunity in the form of vaccine studies. We know that vaccines are effective when the inoculated antigen results in an effective antibody titer. There are some studies that look at, in human subjects, the effects of sleep loss on the subsequent antibody titers levels that form after giving someone a vaccine. And in particular, have been looked at influenza vaccine, the hepatitis A vaccine, and hepatitis B vaccine. Subjects would be deprived of sleep for about 4 hours a night in the days preceding getting the vaccine and in the immediate 1 to 2 days following the vaccine. And it's shown that later on, these subjects develop a significantly lower level of antibody titers compared to those who are not sleep deprived. So there's also this theory that chronic sleep deprivation results in chronic low-grade inflammation. And as we discussed earlier, the cytokines IL-1 and TNF, among other cytokines, get upregulated in the setting of acute sleep deprivation. Well, it's thought that if we have someone who's chronically sleep deprived, they have this chronic elevation in these cytokines. And we know that chronic inflammation has been associated with various medical conditions such as obesity, diabetes, coronary artery disease, cancers, and neurodegenerative disease. So the question is, could chronic sleep deprivation increase our risk for developing one of these medical conditions? Well, that's left, to be determined with further research. There is no substitute for getting adequate and good quality of sleep consistently. If we want to get all of the potential immune and restorative benefits that sleep has to offer.